Welcome to DAML Consult Career Academy. In today's video, we will be walking you through some of the most common and frequently asked radiology assistant interview questions and answers for 2025. If you are preparing for a role in radiology, whether you're a first-time applicant or someone looking to advance in your healthcare career, this video will provide you with the right guidance to impress your interviewers and secure your dream job. We've carefully designed these questions and expanded answers to help you showcase not only your technical skills, but also your professionalism, patient care abilities, and teamwork. Stay tuned until the end, because every detail shared here could make the difference between a good interview and a successful one that gets you hired fast. Welcome to DAML Consult Career Academy. In today's video, we will be walking you through some of the most common and frequently asked radiology assistant interview questions and answers for 2025. If you are preparing for a role in radiology, whether you're a first-time applicant or someone looking to advance in your healthcare career, this video will provide you with the right guidance to impress your interviewers and secure your dream job. We've carefully designed these questions and expanded answers to help you showcase not only your technical skills, but also your professionalism, patient care abilities, and teamwork. Stay tuned until the end, because every detail shared here could make the difference between a good interview and a successful one that gets you hired fast. 2. What do you understand about the role of a radiology assistant? A radiology assistant plays an essential role in supporting radiologists and technologists in the imaging department. The responsibilities can include preparing patients for imaging procedures, explaining the process to reduce anxiety, positioning patients correctly, and assisting with the safe and effective use of imaging equipment. Radiology assistants may also handle administrative tasks such as maintaining patient records, scheduling appointments, and ensuring all procedures comply with safety regulations. Additionally, in some settings, they may be trained to perform certain advanced tasks under supervision, such as conducting specific imaging procedures or assisting with preliminary image evaluation. The role requires a combination of technical skills, patient care abilities, and strong communication to ensure that the imaging process is accurate, safe, and supportive for the patient. Ultimately, the radiology assistant helps bridge the gap between patients and the radiology team, ensuring smooth workflow and high-quality care.
Before we proceed further in this video, designed to help you stand out and impress your interviewers, click on the sealer or fourth wall link in the description box below to download your copy. It's very affordable, and right now, you can get it with a huge 70% discount. Send us an email or a quick WhatsApp message, and well, send it right over. We're also running a special bonus offer: buy one, get one free. When you purchase any of our ebooks, you'll get one extra ebook of your choice, absolutely free. Just send us a message after your purchase and we'll deliver the bonus within 48 hours. You can also join our WhatsApp group to connect with others preparing for the same role. All the details are in the description box below. Want to take your preparation even further? Book a one-on-one coaching session with us using any of the links provided. For more details, contact our online customer care team on WhatsApp or email us. Don't wait, grab your ebook today and get fully prepared to ace your radiology assistant interview.
3. How would you handle a patient who is anxious or fearful about undergoing a radiology procedure? When dealing with an anxious or fearful patient, I would start by approaching them with empathy and a calm demeanor. I would take the time to explain the procedure in clear and simple language, addressing any questions or concerns they may have. Sometimes, patients feel nervous because they do not understand what will happen, so reassurance through education can make a big difference. I would also emphasize safety, letting them know that all procedures are designed to be as comfortable and risk-free as possible. If appropriate, I might use relaxation techniques, such as guiding them to take deep breaths or providing distractions like conversation, to reduce their anxiety. Most importantly, I would never rush the patient. Instead, I would ensure they feel supported, respected, and ready before proceeding. By building trust, I can help create a more positive experience and ensure accurate imaging results. 4. What skills and qualities do you think are most important for a radiology assistant? I believe a radiology assistant must combine both technical and interpersonal skills. Attention to detail is critical because positioning and preparation directly affect the quality of imaging and diagnosis. Strong communication skills are equally important, as the role involves explaining procedures to patients, working closely with radiologists and technologists, and ensuring smooth team collaboration. Empathy and patience are essential qualities, especially when working with anxious, elderly, or pediatric patients who may need extra reassurance. Additionally, having good organizational and multitasking abilities is valuable since the role often involves handling patient records, scheduling, and supporting multiple procedures in a busy department. Finally, adaptability and a willingness to learn are important because radiology involves fast-changing technology, and keeping up with safety protocols and new equipment ensures the highest standard of care. 5. How do you ensure patient safety and confidentiality in radiology? Patient safety is always my top priority, and I would ensure it by following all established protocols, including proper equipment checks, accurate patient identification, and strict adherence to radiation safety guidelines. For example, I would verify that patients are not exposed to unnecessary radiation by double-checking procedure requests and confirming protective measures, such as lead aprons are used when needed. I would also carefully review patients' medical histories and check for contraindications, such as pregnancy or implanted devices, before procedures. In terms of confidentiality, I would strictly follow data protection regulations, ensuring that patient records are kept secure and only shared with authorized personnel. Maintaining professionalism, respecting privacy, and safeguarding sensitive information are central to building patient trust and ensuring compliance with ethical and legal standards in healthcare. 6. Can you give an example of a time you worked as part of a team in a healthcare or professional setting? In my previous role, I worked closely with nurses, doctors, and administrative staff to support patient care. One example was when I assisted in coordinating diagnostic tests for a patient who required urgent imaging. The team had to work quickly and efficiently to schedule the test, prepare the patient, and communicate results to the treating physician. My role was to ensure that all documentation was in order, the patient was informed and prepared, and the imaging staff had everything they needed. By communicating clearly and stepping in to support where needed, we were able to complete the process smoothly and ensure timely treatment for the patient. This experience reinforced my understanding that teamwork, good communication, and adaptability are vital in healthcare, especially in a high-demand department like radiology. 7. How would you handle a situation where you notice a potential error in a radiology request or procedure? If I noticed a potential error, I would not proceed until the issue was clarified. Patient safety depends on accuracy, and even a small mistake in a radiology request could lead to unnecessary exposure or incorrect diagnosis. For example, if I saw a mismatch between the patient's details and the requested procedure, I would pause and immediately raise the concern with the supervising radiologist or appropriate healthcare professional. I would document my observation and follow established protocols for reporting discrepancies. Remaining calm and professional is important in these situations because addressing the issue quickly and effectively ensures that patients receive safe and correct care. I believe it is always better to double-check and prevent an error than to risk compromising patient health. 8. Radiology can be fast-paced and stressful. How do you manage stress in such an environment? I manage stress by staying organized, focused, and calm under pressure. I prioritize tasks and approach each procedure methodically, which helps me remain efficient even in a busy environment. I also remind myself that patients may already be anxious, so staying composed is essential to reassure them and maintain professionalism. Good teamwork also helps reduce stress, as communicating openly with colleagues ensures that workload and responsibilities are shared effectively. Outside of work, I maintain a healthy lifestyle through exercise, rest, and relaxation techniques, which allows me to recharge and handle workplace challenges more effectively. I believe that managing stress well is not only important for my own health, but also for ensuring that I deliver safe and consistent support to patients and colleagues in the radiology department. 9. How would you support a patient with limited mobility during a radiology procedure? When supporting a patient with limited mobility, I would first ensure their comfort and safety by assessing their needs and preparing the equipment appropriately. I would explain each step clearly so they know what to expect and take extra care when helping them move or position themselves. Using mobility aids or additional support from colleagues if needed would help ensure that the patient is transferred safely without risk of injury. I would also be patient and allow them time to adjust, making sure they feel respected and not rushed. After the procedure, I would assist them back to a comfortable position and check if they need any further help. Supporting patients with limited mobility requires empathy, patience, and proper technique, and I would always prioritize their dignity and safety throughout the process. 10. Why should we hire you as a radiology assistant? You should hire me because I bring a combination of healthcare experience, strong interpersonal skills, and a genuine passion for radiology. I understand the importance of accurate imaging in guiding diagnoses and treatment, and I am committed to supporting both patients and the radiology team in achieving this. My ability to communicate effectively and build trust with patients ensures they feel comfortable, while my attention to detail and organizational skills help maintain accuracy and efficiency in the department. I am adaptable, eager to learn, and motivated to grow within this field, keeping up with advances in radiology and safety standards. Above all, I am compassionate and dedicated to improving patient experiences, and I believe these qualities make me a strong candidate for the role of radiology assistant. Do you have any question for us? Thank you for taking the time to speak with me today and for giving me a deeper understanding of the radiology assistant role. I do have a few questions I would like to ask. First, could you share what a typical day looks like for a radiology assistant in your department? I am particularly interested in knowing the balance between patient interaction, administrative duties, and technical support tasks. Second, I would like to know more about the training and professional development opportunities that are available for staff in this role, especially in terms of expanding skills in radiographic procedures and patient care. Finally, I am also interested in understanding how your radiology team collaborates with other departments within the hospital, such as emergency or oncology, since teamwork is essential in ensuring quality patient care. Asking these questions helps me get a clearer picture of how I can align my skills with your department's goals and contribute meaningfully to patient care and service delivery. Thank you so much for watching this video on radiology assistant interview questions and answers. I hope the expanded responses gave you the confidence and clarity you need to approach your upcoming interview with ease. Remember, employers are not just looking for technical knowledge, but also compassion, communication, and a strong sense of responsibility in supporting patients and the healthcare team. If you found this video helpful, don't forget to like, share, and subscribe to Damel Consult Career Academy for more expert interview tips and career guidance. Best of luck with your interview. You've got this.